am Rashmi. Welcome to SRS Info. Today we will discuss some important MCQs related to pharmacy. So the first question, an example of hemopoietic growth factor is. So what is hemopoietic growth factor? Which promotes hemopoiesis. And what is hemopoiesis? Hemopoiesis is blood cell production. So those factors which promotes the hemopoiesis are called hemopoietic growth factor, and here erythropoietin is the hemopoietic growth factor. And this hemopoietic growth factor, that is erythropoietin, is mainly produced in kidneys and some amount in liver also. Okay, and erythropoietin stimulates the erythropoiesis, which is the blood cell production. Next, acetylcholine is a neurotransmitter which is an ester of choline, acid and what? This is very simple. Acetylcholine is an ester of choline, acid and acetic acid. Okay. So this is a neurotransmitter. What does a neurotransmitter do? It transmits the chemical message released by the nerve cells to other cells. Okay. It transmits the chemical message released by the nerve cells to other cells like muscle cells, gland cells, etc. This is the function of neurotransmitter. So acetylcholine is a neurotransmitter which is an ester of choline, acid and acetic acid. Okay, and it contracts the smooth muscles and dilates the blood vessels and increases the body secretions and slows the heart rate. Then what about sulfuric acid? H2SO4. This is known as king of chemicals, and it is also known as oil of vitriol. And what about benzoic acid? Benzoic acid is C6H5COOH. Benzoic acid is an organic acid. Okay, and this benzoic acid is used for the treatment of many types of fungal skin infection and also used as a topical antiseptic. What about citric acid? Citric acid is C6H8O7. This is also a weak organic acid, but this is naturally occurs in citrus fruits. Next, fructose on reduction with sodium borohydride gives what? What is fructose? Fructose is C6H12O6. Okay, and sodium borohydride, which is a reducing agent, NaBH4, sodium borohydride. When the fructose is reduced by sodium borohydride, it gives sorbitol and mannitol. And both the sorbitol and mannitol are sugar alcohol. These are sugar alcohol, and mannitol is used as a sweetening agent, especially for food prepared for diabetic patients. Okay, it also used to decrease the pressure in eyes, mannitol. Okay, what about sorbitol? Sorbitol is also a sugar alcohol which found in plants and fruits. Okay, and some other uses of sorbitol, what are they? This is used as diuretic, laxative and also cathartic. What is cathartic? Cathartic is a psychological relief through open expression. When we are under stress, and if we discuss our stress or the emotions to someone else very close to us, then we really feel a comfortable atmosphere. Okay, we relieve ourselves, we feel that we are free if we share our feelings with some closed person. This psychological relief after this open expression of our feelings, this is called as cathartic, and those drugs which promotes or which provides these feelings are called as cathartic drug. And sorbitol has such a property of cathartic promoting activity. Clear? So the fructose on reduction with sodium borohydride gives sorbitol and mannitol. Next, the drug of choice for trigeminal neuralgia is. What is trigeminal neuralgia? Trigeminal neuralgia is the chronic pain condition which affects the trigeminal nerve in face, and the pain on this trigeminal nerves is called as trigeminal neuralgia. And what is the function of this trigeminal nerve? Trigeminal nerve carries the sensation from face to brain. This carries the sensation from face to brain. This is the function of trigeminal nerve. And the drug of choice for such type of pain is carbamazepine? The answer is option D. And carbamazepine is an anticonvulsant. And what is the function of this carbamazepine? It decreases the nerve impulses. Okay, it decreases the nerve impulses on this trigeminal nerve so that the pain can be reduced. The nerve impulses causes the seizures and nerve pain. Okay, so the carbamazepine used as an anticonvulsant which reduces the nerve impulses on this trigeminal nerve, which reduces the trigeminal neuralgia. And this carbamazepine is also used to treat bipolar disorder. This is a mental illness condition which often marked by extreme shift in mood. The person with bipolar disorder shows extreme shift in mood. At a moment, he behaves as that he is a very happiest person, and at the next moment, he behaves as he is under depression. This is called extreme shift in mood, and this disorder is called as bipolar disorder. Carbamazepine is one of the drug which is used to treat bipolar disorder. And this phenytoin and trimethadione, both these are also used as anticonvulsant. This is used to treat seizures, and trimethadione is a choice of drug in epilepsy. And what about diazepam? It is coming under the category of benzodiazepines, and it produces the calming effect, and it is used to treat anxiety, and it also used to treat the withdrawal symptoms of alcohol and muscle spasm. So diazepam has a number of uses, and it comes under the category of benzodiazepine. So the answer of this question is carbamazepine for trigeminal neuralgia. Next, the records for the drugs having the date of expiry should be preserved for a period of at least what time? The records of all those drugs having the date of expiry should be preserved for a period of 2 years. So the answer is 2 years. Minimum 2 years we have to keep the records of all those drugs having expiry date. The sixth question, epinephrine and norepinephrine are synthesized from what? So epinephrine and norepinephrine, these are neurotransmitters. We already know about it, that epinephrine and norepinephrine, then dopamine, all these are neurotransmitters. Okay, these are neurotransmitters, and these are synthesized from the non-essential amino acid which is tyrosine. Okay, so the answer is option D, tyrosine. And what is the difference between essential and non-essential? See, essential amino acids are not produced by our body. These are not naturally produced by our body, so that we have to take this amino acid by our diet. Okay, so these are the essential amino acid. And what about non-essential? Non-essential amino acids are produced by our body by itself by using other essential amino acid. Okay, these non-essential amino acids are not supplied by food. It is produced by our body itself with the help of other essential amino acid, and these essential amino acids are supplied by diet. Okay, these are the main difference between essential and non-essential amino acid. And tyrosine is a non-essential amino acid which is essential for the production of, for the synthesis of epinephrine, norepinephrine and dopamine types of neurotransmitters. Okay, these are also known as brain chemicals. We have already discussed about the neurotransmitter, and tyrosine is a non-essential amino acid which is produced by the essential amino acid which is phenylalanine. So this is the essential amino acid which we have taken from food, from diet, and by using this essential amino acid our body produces tyrosine which is a non-essential amino acid, and this is the precursor of the production of or the synthesis of epinephrine and non-epinephrine. Okay, and what about glycine? Glycine is one of the simplest amino acid. This is a simplest amino acid, and this is also non-essential amino acid, and which is produced from the essential amino acid, that is serine. Serine is the essential amino acid by which the glycine is produced, which is a non-essential amino acid, and this is an inhibitory neurotransmitter. Okay, then Arginine. What is arginine? This is classified as semi-essential or conditionally essential. Why? Because arginine is very essential for infants. But in preterm infants, this arginine cannot be produced by the infants themselves. So we have to give protein-rich food which can produce this arginine. In such condition, this is called as semi-essential or conditionally essential amino acid. But in the case of adult, there is no need to give this special dietary supplements for the production of arginine. Why? Because this amino acid is present in most of the protein-rich food. This is a very common amino acid which is found in all protein-rich food. So there is no need to give some extra dietary supplement for adult. But in case of preterm infants, it is essential. So that it is called as semi-essential or conditionally essential amino acid. Okay. And in body, this can also be synthesized from glutamine and citrulline. Then what about phenol? Phenol is an aromatic organic compound. What is the formula? C6H5OH. Okay. And this is mildly acidic. Phenol is mildly acidic. But one most important point to be noticed is that this causes chemical burns. So we have to use it very carefully. What are the other names of phenol? Phenol is also known as carbolic acid, phenolic acid, phenic acid, hydroxybenzene. All these are the different names of phenol. Okay. Moving to next. The Schick test, which is used to determine the susceptibility of which disease. Schick test is a skin test and this was developed in 1913 by Bela Schick. By his name, this test is known as Schick test, which is used to determine the susceptibility of diphtheria. What is diphtheria? Diphtheria is a bacterial infection of throat and nose. And in this case, the neck may swell in part, okay, due to enlarged lymph nodes. Lymph enlargement is one of the major symptoms of this diphtheria. This is a very dangerous bacterial infection. And this is spread among people by direct contact through air. Now, there is vaccination is available for diphtheria. What is the vaccination? DPT, diphtheria, pertussis and tetanus, multi-vaccination. Okay, vaccination for multiple diseases, multiple infection. And what about tetanus? Tetanus is also a very dangerous bacterial infection. Diphtheria is caused by which bacteria? This is caused by Corynebacterium diphtheria. This is the causative organism of diphtheria. And what about tetanus? Tetanus is caused by Clostridium tetani. This is also a bacteria. And tetanus can be prevented by using vaccine. And DPT vaccine is also used to prevent tetanus. And what are the main symptoms of tetanus? There is a severe muscle spasm, uncontrollable muscle spasm which may lead to the breaking of bones. This spasm and breaking of bones may lead to death also. So tetanus infection is very dangerous condition. The vaccine of tetanus was first developed in 1924. And what about tuberculosis? Again, the tuberculosis is a bacterial infection. Which bacteria? That is Mycobacterium tuberculosis. This is the causative organism of tuberculosis, and this tuberculosis spreads through air. And tuberculosis affects our lungs. And the vaccination for tuberculosis is BCG. What is the full form of BCG vaccine? Bacillus calmette-guerin vaccination. That is BCG vaccination. And nowadays there are multiple antibiotics are available to treat tuberculosis in different steps. Okay, there are different criteria for administering these drugs. Some of them are rifampicin, isoniazid, ethambutol, and pyrazinamide, rifabutin. These are some of the drugs which are used to treat tuberculosis. Okay, so this is a bacterial infection. The causative organism is Mycobacterium tuberculosis. And typhoid, again this is a bacterial infection. And which bacteria? That is Salmonella typhi. And this typhoid is caused by the use of contaminated food and water. This spreads to contaminated food and water. So hygienic use of food and water is very important to prevent these types of diseases. Okay, and there are antibiotics are available to treat typhoid. Conjugated vaccination is also available. So these are the information about these diseases. Here the Schick test is used to determine the susceptibility of diphtheria. Next, metoclopramide is generally used for what? Metoclopramide is generally used for the prophylaxis of vomiting. What is prophylaxis? Prophylaxis drugs are used to prevent the occurrence of that diseases. Okay, so metoclopramide is such a prophylaxis drug for vomiting, especially during the surgery and after the surgery there is a tendency of vomiting. Okay, that conditions can be prevented by metoclopramide. That is intra-operative nausea and vomiting and post-operative nausea and vomiting. These are the main conditions where this metoclopramide is used, and this is an dopamine antagonist, that is anti-dopaminergic agent. As this is a dopamine antagonist, this blocks the dopamine receptors. What are the other uses of this metoclopramide? This mainly used in nausea and vomiting, and this is a very good use in migraine along with paracetamol. Okay, the metoclopramide along with the paracetamol works in migraine effectively. This is also used in gastroparesis. What is gastroparesis? Poor stomach emptying can be called as gastroparesis, and in such cases it helps in the GI reflux disease, which may promote the stomach emptying, okay, and which will help to reduce this gastroparesis. These are the main use of metoclopramide. It is used as the prophylaxis drug for vomiting. Next, the poisonous drugs are covered in which schedule? According to Drugs and Cosmetic Act, the poisonous drugs are covered in the Schedule E. The answer is option A, Schedule E. The poisonous drugs and their regulations are covered in the Schedule E, like Serpovisha, mercury, etc. These types of poisonous drugs and their regulations are covered under the Schedule E. What about Schedule F? Schedule F explains about the regulation and standards of running a blood bank. The regulations and standard for running a blood bank are covered in the Schedule F. What about X? All drugs which are to be dispensed only with prescription, that is prescription drugs, are covered under Schedule X. That means the drugs which cannot be purchased over the counter. This can be dispensed only with the valid prescription of a doctor. And what about Schedule Y? Schedule Y covers the requirements and guidelines for the permission to import and manufacture of new drugs for sale or for conducting the clinical trials. These requirements are covered under Schedule Y. So here the answer is option A, Schedule E. Next, an excess of nitrogenous waste in blood causes what? What are these nitrogenous waste? The end products of the amino acid and protein metabolism are the nitrogenous waste. What are the end products? Mainly urea and creatinine. Okay, these are the main byproducts or the end products of this metabolism of protein and amino acids. Okay, and what happens to this waste product? The kidneys filters the waste products and passes through urea. The excretion process happens. But if the kidney is not functioning properly, then the excess of this nitrogenous waste gets abundant in our bloodstream, and this will cause uremia. Okay, the answer is uremia. What is uremia? It is the abnormal high levels of the waste product in the blood which leads to uremia. And this is a very dangerous condition that occurs when the kidney no longer filters properly. If the kidney does not function or filter properly, then this dangerous situation of uremia occurs. And when this uremia occurs, then there is loss of appetite, nausea, vomiting, tremors, abnormal mental function, Even renal failure occurs. Renal failure will also lead to coma, which may lead to death. So this is a very dangerous condition when the excess of nitrogenous waste gets abundant in the bloodstream. The most proposed treatments are, one is dialysis and other is kidney transplantation. Dialysis and kidney transplant are the mainly proposed treatment for this uremia. Okay. And what is acidosis? Acidosis is the increased acidity in the blood, that is increased hydrogen ion in the blood and the body tissues. Okay. And what is alkalosis? It is the loss of acid, decrease of acid, and the abundance of the bicarbonate. This is the abundance of hydrogen ion, and alkalosis is the abundance of bicarbonate. There is a decrease of acid. And what is kidney stone? Small and hard deposits of minerals in the kidney. This is known as kidney stones. This is also called as renal calculi. Normally, this is not dangerous, but it is very painful when these stones pass through urine. Okay, so it's very essential to drink enough water, okay, so that we can control these types of sedimentation, which may lead to kidney stones. So here the answer is the excess of nitrogenous waste in the blood causes uremia. Okay, so this is the end of class. Let me conclude with the quote of Nelson Mandela. A winner is a dreamer who never gives up. Thank you.